Hey, it's Dr. E with EmmanuelTherapist.com. Just a quick example of what I learned from a few patients who were not getting better, or at least they weren't staying better between visits. And the directional preference was correct, and I was 100% positive that they were doing their exercises correctly and they were dosing appropriately. So basically I was telling a patient to do her home exercises probably 10 times an hour, and maybe every other day she was coming back better. Some visits she was better and some visits she wasn't. And repeatedly I asked her, is there anything you were doing, or is there anything you're doing on these days or the day before where you're coming in and you're not better, differently than on days where you're coming in and you are better? And at first she said no, but then after a while she said, I never told you I have a part-time job where I'm folding laundry. She worked part-time at a dry cleaners, and she pretty much folded what she said hundreds and hundreds of pieces of clothing repeatedly throughout the day. So she was her directional preference was a retraction and overpressure, and on some days that was making her better. But on the days where she was actually folding laundry and she was doing a lot of repetitive flexion and internal rotation, that was kind of negating the effects of the reset. So I simply suggested on those days, take a quick break and do 2 or 3 retraction with overpressures, maybe every 5 to 10 minutes. And that's all she really needed. It was the variability that she needed to be introduced into her nervous system for the green light to stay on and the red light to stay off. So if your patient if you have chosen the correct directional preference and the patient is doing it correctly and they leave better, but they don't come back better, it's often something they're doing in between visits to kind of negate the effects of the directional preference or the reset. So if they have a repetitive activity or a position that they're doing more often than the reset, they may need to do it more often, or they need to dose it more often, or they may need to avoid that activity that is negating the reset. All right? Hope this helps. Have a great day.